Welcome to Public Health Matters, where we talk about matters of public health. I'm Bobbie Bagley, Director for the City of Nashua's Division of Public Health and Community Services and Chief Public Health Official for the City of Nashua. And I'm joined today by Phil Setten, who is the Research Director for the New Hampshire Fiscal Policy Institute. And Phil and I are going to talk about all things related to the budget and what you do at the New Hampshire Fiscal Policy Institute with regards to analyzing policy issues related to fiscal matters. So Phil, tell us a little bit about the New Hampshire Fiscal Policy Institute, what you do there, your team, and the focus on policy.
Right, great. Thank you for having me, Bobbie. I really appreciate it. So we at the New Hampshire Fiscal Policy Institute, we are a nonpartisan, nonprofit, independent policy research organization. We examine the state budget, state revenue, the state economy more broadly, and the economic security of Granite Staters, particularly those of us with low and moderate incomes in the state. There are 7 people working for NHFPI, so we have a team of 3 researchers, and then as executive director and additional administrative and communication staff. And our goal is really to get high quality public information out for everyone to use when thinking about public policy, when understanding what are the impacts of public policy on our economy, on our economic and fiscal and financial lives in the Granite State, and how does that all interact with how the government and the state budget are structured and affect services that we all rely on in the state.
Awesome. And folks might wonder, what does that have to do with public health matters? Well, one of the 3 core functions of public health is around policy development. And one of the things that we like to do is we try to help make sure that the constituents, consumers, all of those who invest in and are stakeholders of public health services understand policy development. And there is a fiscal component, Fiscal Policy Institute, to the budget formation. And so there are things that you all do with collecting data that helps inform how dollars should be spent or the impact of dollars. So let's talk a little bit about that. And at the New Hampshire Fiscal Policy Institute, you've actually created a book that guides people to key points around policy and fiscal matters. So let's talk a little bit about that for Granite Staters.
Sure, absolutely. So there's a lot of information out there, and we process through a lot of information at NHFPI. And it's sometimes hard to look at a 1,300-page budget proposal and say, what does this mean for me if I'm looking at what the state government is considering doing over the next 2 years? And we really try to boil that down for folks. And the one place where we've most comprehensively done that to try to help people have the background that we all need to be residents of the state to try and understand a lot of these challenges facing the state is in a book that we call New Hampshire Policy Points. And you can access it for free as a PDF on our website at nhfpi.org, or you can order a copy if you want a physical copy. But it's designed to really walk you through some of the key issues that are facing the state: population and demographics, the economy, the workforce, food insecurity, health, housing, child care, early care and education funding. We go through all of those topics, as well as how are public services funded and what does the state budget actually include to address these issues.
Yeah, and it's awesome. So we got a chance to take a look at this earlier today, and there are a great deal of key points in here and some really good information for anyone, right? And so in particular, when I think about how we digest information that we get in public health, because our goal is how do we help people stay informed so that they can make the best decisions about their health. And that includes even fiscal decisions, as well, especially since it does inform how monies will be allocated to address certain areas of health and public health. We've talked about housing here on Public Health Matters and the impact and how housing is health. We've also talked about, most recently, we've had an episode that talked about child care and the access to affordable child care. And so those are some of the things that you also talk about in your booklet here as well.
And we have some separate research reports about all of those too, where you can dive into more detail, and people looking for a little bit more understanding of some of those issues can go even a little further than what you see in the book. So for example, my colleague, senior policy analyst Nicole Heller, recently produced an analysis of what is the economic cost of not having enough available childcare in the state. And for each childcare slot that was a shortage relative to what likely need is out there, given the number of parents who are in the workforce and the number of children that they have. It's up to about $35,000 per slot cost to the economy. That's
Wow.
family wages, business income, and state and local tax revenues. It impacts all of those. So that's the sort of analysis that we at NHFPI try to provide on a regular basis to inform policy conversations and individuals who are looking out for their own health and well-being or the health and well-being of their communities.
Right, and that's awesome. And so let's talk a little bit about some of the key findings that you all have had in your most recent analysis. And in particular, let's talk about the budget, because that is a hot topic, right? Because of some of the budget allocations or some of the changes to the budget and the impact that that's going to have on individuals, and in particular, even for us at Public Health and some of our partners that deliver certain services. And one of the things in particular, Phil, that I'd like for you to talk about is Medicaid, the impact of Medicaid cuts for individuals who receive those services, and those some of our partnering organizations that actually benefit from Medicaid reimbursement and how that can impact our workforce.
Yeah, so at the state level, and I should say Medicaid in total, if you take all the dollars put together, is the single largest program that the state operates. It provides health coverage and access to health services for generally for people with lower incomes in the state, but also for people with substantially higher incomes but specific needs or in specific situations.
Right.
Nearly half of Medicaid enrollment in New Hampshire, for example, is children. So children are significant beneficiaries, even if their parents aren't enrolled in Medicaid.
Right.
The children's health is supported through Medicaid if they're enrolled in the program. Now, Medicaid is the single largest program the state operates in dollar terms as well. It's about $2.6 billion this year is what the projection is. And that is a mixture of state and federal funds. So there's both a state budget interaction and a federal budget interaction. On the state side, if we look at the governor's budget proposal, there are some changes to Medicaid. There's a reduction in uncompensated care payments to hospitals, for example, an increase in uncompensated care payments to mental health services. There's a reduction in home and community-based services for older adults and adults with physical disabilities, but an increase in nursing facility payments.
Okay.
So there are some trade-offs, some gives and takes on that front, as there is in sort of any budget discussion, although those aren't all the same magnitude changes.
Right.
And for Medicaid enrollees, there are some important changes as well regarding the amount that they would have to pay for co-payments for prescriptions, but also premiums. Certain Medicaid enrollees, especially adults with low incomes, but that are incomes above the poverty level, but not that far above the poverty level, because you can't have incomes that are that high if you're an adult and don't have any other situation going on and be enrolled in Medicaid. And for families with children who enrolled in Medicaid, there are premiums that the governor has proposed that are up to 5% of an individual's income to be enrolled in Medicaid. So there's a lot of details we don't have about those yet, but that would be a substantial change for some of those households.
So when you think about that, and as you and your team were analyzing some of the impact of some of these changes, and because when I think about individuals that may have public insurance as their source for providing for their health care, and if I've had zero of a payment, when I go in, and now I may have to pay something to, $4. What does that look like for an individual that has already a fixed or no income, and that's why they qualify, for public insurance, that now I'm going to be paying a copay?
Yeah, so the details of these policies will really matter in terms of what it means for access for individuals.
Okay.
There are ways potentially that the policies could be set up so that individuals have to pay if they are able to, but there may be a way for those individuals to not pay if they are not able to. But I'm saying may because we don't know those details yet. At this point in the policy proposal, there's not very much written down, and that these policy proposals will develop over time. They may change substantially, but those policy details will matter a lot for what's in that individual person's or household situation. That being said, if we think about the access barriers that could be put in place by if there is a requirement to pay to remain enrolled, or even if there isn't, but someone is facing substantial other costs in their household, that may be a discouragement, right? That may be a disincentive to access health services, including preventative health services that may reduce costs down the road. So And if we look at household incomes in the state, when we're talking about incomes that are near poverty level incomes or poverty level incomes, we're talking about incomes that are substantially below the cost of living estimates that are available, for example, from the Massachusetts Institute of Technology. There are cost of living estimates for the state that are substantially higher than what we see in those poverty rates, or even 2 or 3 times the poverty rate, which is where some of these premiums would kick in, for example, with households that have children who are insured in them.
Now, Phil, what do those numbers actually look like? Because a lot of times people explain them by the percentages, 100% at poverty level, 200%, 325%. When we talk about actual dollars, what are those dollar amounts that we're speaking of?
Right, so when we're talking about poverty level income and thinking about, is it 100%, is it 200%, is it 300%, when we're talking about the poverty guidelines, the poverty thresholds, those are for a single individual. It's about, in New Hampshire, it's about $15,000 for a single individual who's under age 65. For a household of 3 people, it's a little over $20,000. Household of 4 people will be a little closer to $30,000. But we're not talking about very high incomes relative to estimates of the cost of living. So, for example, the Massachusetts Institute of Technology estimates that statewide, the cost of living for a modest but adequate standard of living, so this includes food, transportation, housing, which is the largest slice of the pie, if you will, in the budget, taxes, health coverage included, or health care included as well, and other necessities, childcare being a part of that, because it's 2 working adults and 1 child in this model. That's a little over $100,000 a year is the estimated cost of living. So if you're talking about a household that's making $20,000, $25,000, $30,000 a year, or even 2 or 3 times that, then you're substantially short of that cost of living estimate, which, by the way, that doesn't include any higher education costs, doesn't include saving for retirement or for emergencies, and also does not include, it assumes that you're renting as opposed to buying a home, whether it's saving to buy a home or paying for a mortgage as opposed to rent.
Yes, and so we're talking significant low income, and yet we want to put a premium on health insurance or that could actually create a barrier for some seeking, like you mentioned, preventative healthcare services. What is it, Phil, that you would like for our viewers to know about the importance of understanding why it's important to pay attention to the budget and the affairs of the budget and the policy making around this? Because in New Hampshire, we have a government where we have 400 in our House and we have 24 in our Senate, but they're very accessible to us. So as a person who analyzes and is looking at this information and gathers understanding about the impact of some of these changes, what do you want our viewers to know about these things with regards to some of these changes, and how would you encourage them to get in contact with some of their legislative leaders to pay attention to how some of these changes could impact them personally, or some others that they know?
Yeah, so I think it's very important, especially when we're thinking about fiscal policy, where the dollars flow.
Right.
I think it's very important for people to recognize that local, state, and federal governments don't operate in silos.
Right.
About 1/3 of the state budget in New Hampshire is funded with federal transfers. Right. Federal money funds about 1/3 of the state's operations in New Hampshire. Medicaid is federal Medicaid dollars were the single largest source of state revenue last fiscal year. It was larger than the largest tax revenue source. The business profits tax was larger than liquor commission and lottery commission sales. The $1.4 billion that came from the federal government, that's the federal government's choice. Right? The federal government can and is considering now changing that amount of money that flows to the state, which could affect the rest of the state budget. Similarly, if you're at the local level, thinking about local public services, there's an interaction with the state there too, because the state provides funding for local governments for either specific services in some cases, like education, or environmental and wastewater services, or general operating support. And that's provided through the meals and rentals tax distribution, for example. So these different levels of government are all integrated. And one of the things that is, I don't think is always recognized is that in New Hampshire, we have lots of public officials, many of whom are either volunteers or close to it.
Right.
And those, and many of them are information hungry and want to hear from their constituents. So whether it is a state level policymaker or a local level policymaker, it's important to know that because we have so many, a voice from an individual may access that in a way that in other states you may not have that opportunity because more people are represented by each individual, either local or state representative. And that's not something that is as much of a challenge in New Hampshire. There's more access because there are more individuals. And because there's so much interaction between local government and state government, the same message delivered to each one of them can affect public policy in a way that, even if it only changes it at one level, can affect what happens at the other level.
That's awesome, right? That's awesome in New Hampshire that we as individuals can become a collective and impact some policy decision making, right? So Phil, I want to go back to the Medicaid because that is really important. You talked about it being the largest amount of fiscal resource that comes into our state. If there are changes to that, there can be an impact on service availability and access to services. We talked about healthcare services that individuals can access when they are Medicaid recipients. But then there are other things that are also done with some of the dollars that come in from Medicaid reimbursement that impacts workforce. For agencies such as mental health centers or our community health centers. Even us at Public Health, if we have some reimbursable services that we're providing, it supports our workforce, right? And so there's two components to this. Those who can have access to healthcare services because they're Medicaid recipients, but then there's that reimbursement where it comes in, those dollars can be used to help support other services in our communities.
And even though Medicaid is a state-federal fiscal partnership, meaning the federal government pays for more than 50% of it, was about 56% last year, and the state government pays for the rest, the state does have control to a certain extent over what those reimbursement rates are. And when I say reimbursement rate, what do I mean? If I'm a Medicaid enrollee and I go to get a service that I need, right? I've broken my arm and I need to have a cast, right? That has a certain reimbursement rate, meaning that I'm a Medicaid enrollee, I've received this service, someone who is my provider then is reimbursed by the state for that service or for the particular set of services involved in addressing my broken arm. And the state has some control over those reimbursement rates. The current state budget, not the one that's being negotiated now for the next 2 years, but the current state budget substantially increased reimbursement rates, particularly in some key areas of Medicaid expenditures. And those increased reimbursement rates means that that provider that I went to who had, who took care of my broken arm, they then have a little bit more fiscal capacity, a little bit more space, a little bit more revenue from me being a Medicaid enrollee to fund their staff, right, to hire someone. If I were uninsured, if I weren't a Medicaid enrollee, maybe I'd be able to pay out of pocket, maybe not. And if I couldn't pay out of pocket, then either that provider would have, that healthcare provider either wouldn't be able to hire as many staff or pay them as well, or they would have to raise prices for other individuals. For example, those who have private health insurance, those who are private pay, or finding some other way to offset the loss of revenue from me not being enrolled in Medicaid or having a lower Medicaid reimbursement rate.
Yeah, so the funds that come in through that can be used in a variety of settings and help support our workforce. And we know that over, since COVID, we've had a decrease in our workforce, and we want to build that back up because when we have individuals that are in certain fields providing certain services, it just helps our population overall with resiliency in our ability to maintain and sustain our health and our well-being. So let's talk about another component of health, which is housing. Because housing is health. I mean, if I could make all things, Phil, about public health. Right. Public health matters in all things. And when we look at, again, at our general population, and we're coming from a population-based approach, and we're looking at things where there are factors that can impact health, housing is one of those things, right? And so what parts of the budget have you all had to analyze with regards to housing?
So housing is actually a very small part of the New Hampshire state budget. Even though it's one of the largest factors holding back our economy, or eating up a larger share of household budgets in New
Okay.
Hampshire, there's actually, as a percentage of the state budget, it's very, very small. There were some significant investments in the current state budget in housing. There were one-time investments in the state's affordable housing fund, some additional incentives for municipalities and for developers to produce housing, including multifamily housing units. And there were additional investments made in services or reimbursements for homeless shelters or for housing shelter programs for people who are unhoused. And those investments were by and large not repeated in the governor's budget proposal, except for the services for housing shelter programs. And that was actually boosted, particularly for individuals who are facing some sort of opioid use disorder or some other substance use disorder. The governor has flagged additional money for that in her proposal. So there's a boost on that front. However, on the housing construction front, there is some streamlining of regulations, particularly with regard to environmental regulations around endangered species, that's designed to accelerate housing construction or at least limit the timeline on the state's end relative to permitting. Again, not affecting what's happening at the local level, but at least the state's portion of the permitting process would be shortened or have a time limit on it. And the governor did extend some pre-existing funding in her proposal, but it's not nearly as much of a housing investment as we saw in the current state budget, at least based on what we see in the governor's proposal.
Yes, and we've had the opportunity here in Nashua to benefit from some of those dollars from the last governor's budget with regard to extending or expanding housing, because again, like you mentioned, there has been such a need for increased housing and increased building. One of the things that we have noted, though, is that with most of the increase in the housing, the affordability, right? And so we want to make sure that, there is some focus on making sure that as we're building houses that are, or housing units or dwellings that are affordable, right? And so that's all relative, like who can afford, what type of housing, but we have been able to see some of that in Nashua increase with housing availability, which is great. And it actually is really good to hear of some emphasis on those who are unstably housed or are impacted by homelessness, that there is a consideration in the governor's budget with regards to making sure that resource is available, because we're also across the state, and not just in New Hampshire, but across the country, housing is an issue, or homelessness, as one of those factors that's impacting the health and well-being of people in communities across the United States. It's still there. This goes back to, I'm thinking of when they first started doing the homelessness management information system back in the 80s. So it's like 40 some odd years, coming on the anniversary of enumerating or counting through the point in time the number of folks that are unhoused. So it's good to hear that there's a component of the budget that will be focused on that.
And just on that point, we've seen in New Hampshire, nationwide, but in New Hampshire in particular, if we look at those data that you just mentioned, there are two different data sets there.
Correct.
Both of them showed a substantial increase in homelessness in New Hampshire. And when I'm talking about a substantial increase on the order of 25, 50%, not 10%,
52.
right? Yes.
52% from the last point in time count.
Yeah.
Which is significant. And then we've actually seen an increase here locally in Nashua as well. And, that's one of our focuses on public health. We started looking 2 years ago at what could we do to help decrease housing instability before the person gets to the point of homelessness. And so there are things that you want to do to protect the housing that a person may have. And that's why I'm so concerned about some of these cuts, because if we make some of these cuts in resources in our budget, in particular with Medicaid, because some of the folks that have some of the jobs that we need in our workforce, it's going to come from this Medicaid reimbursement that's going to come in some of these agencies. And so therefore, that's such a touchy subject. But there's one other thing that, Phil, I did want to talk with you about, because there were 3 priority areas that you mentioned that we've been focusing on here in our strategy and in our in public health. And that was, we talked about the housing, we talked about the Medicaid, because that's access to health care, and not just health care, dental, because there was an increase in availability for dental care through Medicaid expansion, and then also mental health as well. But the other piece that I wanted you to speak to was around the child care, because we've also seen and have heard and learned that there's these, and you started talking about this earlier, that there's these vacancies, and there's so much of this childcare service, that affordable childcare service that could be available, if people were accessing it. And so there is a component in here in these key points that addresses that as well, because there's some childcare services that can be reimbursable. Is that right? Is that correct?
So there's a child care subsidy. So there's the New Hampshire Child Care Scholarship Program.
Correct.
That households, more families, actually under the current state budget, it was expanded to more families in terms of their eligibility. So both the number of households in New Hampshire that can access the child care scholarship program and help them pay for child care, that has expanded in terms of the number of households, but also the amount of the subsidy for many households has expanded as well, because the state is limiting the amount for people who are enrolled in the child care scholarship program, limiting the amount of income that would go to child care to 7% of their income. So it's a substantial increase in public support for child care in New Hampshire, also reimburses the child care providers themselves on the other side.
Which is awesome, right? So Phil, I thank you so much for being here with us as we talk about matters of public health and connecting the importance of understanding the budget, the process, and the fiscal policy piece along with that as well. So we've got a couple of minutes left, Phil. What do you want our viewers to understand going into this budget season?
Sure, and we've already talked a little bit about some of the changes that the governor's budget has proposed. She is, in her budget proposal, faced a more constrained revenue environment in terms of the revenue projected to come in than the budget writers in 2023 did for those folks writing the current state budget. That's a change in both the trends in existing revenue sources and revenue sources that are available. So business tax revenues, which are key revenues for the state, are down about 20% so far this year. We'll see if that continues to the rest of this year. And the state did eliminate the interest and dividends tax, which that is something that took effect at the beginning of this calendar year, meaning those dollars, which was $184 million last year, are not available going into the next budget cycle. So the governor was already in a more constrained environment in terms of what she could invest in. For example, there was $15 million invested in the child care workforce in the current budget that the governor didn't repeat, similar to those housing investments. Right now, the House Finance Committee is considering the governor's budget and making proposed amendments to the governor's budget. The House Finance Committee has much lower revenue estimates that they're working with relative to the governor. So that's going to substantially change what the budget looks like as we move into the rest of this process. The Senate will take its turn looking at the budget after the House is done with its work. And there are a couple other big factors that are still looming out there, including what the federal government does relative to funding that flows to the states. So there are several different moving pieces, maybe more than we have in a usual budget cycle, although we haven't had what you might call a usual budget cycle in some time in New Hampshire. But there are enough moving pieces that it's going to be a very dynamic environment and important to watch, because this next state budget is likely going to have fewer resources available, at least in terms of services that could be added on, than the current state budget. And there could be substantial reductions depending on what the final revenue estimates look like.
Thank you, Phil. So you heard Phil Setten, who is the research director at the New Hampshire Fiscal Policy Institute, telling us that we need to watch. And so we want to make sure that we do that. And if there's more information that you want to have a better understanding of the New Hampshire policy points, you can go to the website to get more information, to get the guide that has the key issues facing Granite Staters, to have a better understanding of that. We want our public, we want our viewers to be informed, well informed, and make those calls to your legislator, to your representative, when it comes down to these things that can impact access, that can impact our workforce, that can impact housing, and that can impact access to health care. I'm Bobbie Bagley, and I'm reminding you to have a great day today and a better day tomorrow, and I'll see you next time on Public Health Matters.